This is a short video on insulin pumps because I failed to really cover it in the regular lecture. Insulin pumps are simply another way to deliver insulin in a subcutaneous way. So it's a continuous subcutaneous infusion. Insulin pumps have been available since the 70s, but have only in the last decade taken on common usage. They're non-implantable. Here's a picture of one with tubing running out to an infusion set, which is subcutaneous, and there's a needle on the other side of that set. They deliver continuous subcutaneous infusions, which are delivered as a continuous infusion and also as boluses. Mostly found in younger type 1 diabetic patients. The use is increasing, especially in adolescents and young adults. And recently there's been some use of the pump or the now specialty type 2 insulin pump for type 2 diabetics. There are no clear guidelines because the efficacy remains variable in terms of the research studies. And we are aware that there are significant psychographic and economic barriers. Advantages of the pump include flexible management of diabetes, allows for adjustment of basal insulin to daily requirements and circadian needs. That would be the continuous infusion rate can be varied through the day to respond to different needs and to varying circadian cortisol levels to result in really tight glycemic control if the patient wants to be that interactive with measuring their blood glucose and adjusting their pump. It reduces the occurrence of hypoglycemia without increasing occurrences of DKA, and some new evidence suggests there may be a role for pump therapy in reducing microvascular and macrovascular diabetes-related complications. There are some barriers to the pump. The first one is cost. A typical pump runs about $7,500 to $9,000. The sets are expensive. The insulin, of course, is the same cost as it would be for any delivery method. A major concern is the patient's ability to engage with technology and the patient's motivation to actively manage their disease on an hour-to-hour basis. It is not uncommon for diabetics, to think that they want the insulin pump because it will make the management of their disease automatic, an autopilot sort of thing. It is commonly misunderstood that an insulin pump measures your blood glucose and then makes adjustments automatically to deliver the best dose of insulin, and that is simply not true. It does not connect to the blood glucose monitor directly. The interface is the patient. So they come in thinking, I'll just go on autopilot and I won't have to worry about this anymore. And when they find out that actually they're going to be measuring their blood glucose more frequently to make adjustments on their pump, they are not oftentimes as enthusiastic. They don't have to finger stick, of course. They can use these pads like you see here in the picture, and then hold their blood glucose monitor over the pad and get a reading so that they're not constantly poking their fingers. But they still have to do the readings frequently. So here's a picture of your typical insulin pump patient. Young, well-educated, very engaged with technology, very high health literacy, active, involved in active cardiovascular type activities. It is especially beneficial to performance athletes because they have traditionally, diabetics who are athletic have had a hard time maintaining a stable blood glucose level because they have such large variation in their metabolic demand based on activity, from days they train to days they don't train, and in the course of any given day when they're playing or performing the sport or they're training, and when they're at rest, they can have a lot of bouncing around of their blood glucose level, and it's been a problem, and also a lot of hypoglycemia, which of course is a problem with with an insulin pump and a blood glucose monitor that doesn't require them to poke themselves to get blood every time, they can really hone in on giving themselves exactly the amount of insulin that they need on an, well, not minute to minute, but every 15-minute basis if they want to. But again, it's got to be somebody who wants to spend a lot of time managing their disease and has a lot of comfort with the technology, as well as has the financial resources to pay for this relatively expensive treatment mode. And that should take care of it for you. Thanks.